Well, good afternoon, everybody. This is Brian Dayton at the West Virginia Chamber of Commerce. I want to thank everybody who's joining us today for this webinar on the new Childcare tax credit bill, but more importantly, a webinar to really talk to employers about how to set up a childcare facility if they choose to take advantage of the new law that was just passed. We're joined by a great group of people today. We have three individuals from the YMCA that I will introduce in just a minute. But first, the first person I want to go ahead and kick to is Senator Tom Takubo. He was the lead sponsor of Senate Bill 656, which was the top priority for the West Virginia Chamber of Commerce this past legislative session. And this is a bill that we view as a workforce development bill, a way to get more people back into the workforce. And there were a number of people in the legislature who were very instrumental in making this happen. And then on the Senate side, when we had this bill, I went and saw Dr. Takubo. You can see he's in his medical gear right now. He's been taking care of patients. But as soon as I went and talked to Dr. Takubo, he said, "I love this idea. Let's get it going." He was our lead sponsor, a true champion and an advocate for this bill. And so what I want to do is just kick it over to him for a few minutes to talk about the overarching things this bill does. So we're very grateful to him for his service to West Virginia. And without further ado, Senator Takubo, take it away.
Ryan, thanks so much. And thanks really all of the Chamber of Commerce. You guys are wonderful advocates and assets that we have over in the legislature. And when Brian came over with this bill, it was much needed. Everybody knows that and talked about it. And especially more than ever in the past couple of years with the pandemic, part of the biggest struggle that we've had is keeping the workforce in place, and especially the healthcare workforce. There are so many nurses, respiratory therapists, even physicians that were affected when schools and daycares and everything were shut down, and we vitally needed those people at the bedside, much like many other businesses. Restaurants, others were affected as well. But this is a great first step to a solution that I think could really help a lot of problems moving forward, even outside the pandemic. There are a lot of folks that would like to come to work, but they also want to start their families, and healthcare is a real issue for those, and it kind of cripples our workforce a little bit. We have a very older population, and so the younger people, they have kids, and oftentimes they just don't have the right resources to allow them to stay in the workforce, and so sometimes it becomes more of an economic decision than what they would like for their career and lifestyle. But this goes a long way into helping take the first big leap into fixing that problem. What we did was allowed, and the bill went through several iterations through this. I think it showed great bipartisan support and effort. Not only that, but along with the House members and Senate members working together to kind of craft this into a workable solution. But we had a bill that basically said they would give you a 50% tax credit back. We made some adjustments to help both for-profits, nonprofits, other community businesses that maybe weren't part of it, but were able to buy those tax credits to help their businesses and help the economy of what they were trying to do. And there is some provisions in there. It's based over a 5-year period where you basically kind of recoup that 50% credit back, or close to probably 50% credit. And there was also some provisions for critics that says, well, this may be a way to abuse the system or abuse the West Virginia taxpayer. And so those clawback provisions basically say this has to be up and operational for a total of 14 years, or you're going to, pay some of this back. The goal is to get communities of businesses to come together, or larger institutions to start their own. And I think it's a great first step. I think we probably could have even been more aggressive, but when you're doing something, it's very rare for a great idea to get through the legislature the first go around, and this did. But it did because we had the support of Brian and the whole chamber backing us and helping us, and giving legislators the confidence that this was something that could really move things forward. And so I'd be happy to take questions. I know there's more on the call here with the particulars of actually opening these facilities with far greater knowledge than myself. But any questions about the bill, I'll be happy to help with those.
Well, thank you, Senator. Just to everybody on the call, if you'd like to ask a question, there are a couple ways. You can type it into the chat box or the Q&A box, or you can raise your hand and I can allow you to speak. I just want to give another word of thanks. Again, there were a lot of real rock stars in the legislature to move this bill forward. And you just said it a second ago, it's rare to get a good idea through on the first time. It sometimes can take a few years. Had it not been for people like Dr. Takubo, like Kayla Kessinger over in the House, we would not have gotten this bill. I mean, there were some really instrumental people who just kept their shoulder into it and pushed this through. And I know, speaking on behalf of the West Virginia Chamber, we are very, very grateful for that. And the group we have here today, the attendees we have joining us, I was looking through the attendance list a little while ago, and I mean, this represents some of the great companies in this state. I think people who are really looking to take advantage of this and provide more childcare opportunities in West Virginia. So at this point, I don't see any questions coming in. Dr. Takubo, I know I just was texting with you a little while ago. You're taking care of patients today. It's one of the great things you're doing. So you're welcome to stay as long as you'd like, or if you need to jump off and go back, we understand completely, but really appreciate everything you've done, your leadership on getting this bill passed. Couldn't have done it without you.
Well, again, thanks, Brian. And I was planning on staying on the call, but we have had a incredibly busy ICU transfer day, and we got some really sick folks. So I'm going to have to jump off a little early here, but I'm sure it's in good hands, and there will be a lot of great questions and expertise, and most importantly, we hope to get to see some of these things up and running. And when we see the things we can make better, adjust those, and so that hopefully this program expands across the state. And what I would love for it to be is a model piece that maybe the rest of the country looks at.
Well, and just on that note, what I will share is our counterparts at the U.S. Chamber of Commerce have told us that they view this as one of the most forward-thinking pieces of legislation dealing with childcare and creating that. So I think we have a good hope that that's going to be shared around. And again, thank you for being the lead sponsor on this.
Absolutely, anytime.
All right. Well, thank you. I'm next going to go ahead and hand it over to Sarah Bolliard with the YMCA. The bill allows a lot of different things, and I'm happy to answer any questions along as what the bill entails. If you want to take advantage of it, there is a component of how do you create a child care facility? Well, what do you need to know? It is incredibly complex. So we actually had a meeting with the Y a few weeks ago at the chamber, and we talked about, hey, this would be a really great thing to host a webinar for the members of the chamber, because the Y has expertise in this matter. They run child care facilities, they know what they're doing. And this could be a real opportunity for businesses, not just to hear from the experts, but perhaps to create a relationship with an organization like the Y to manage one of these facilities should they choose to take advantage of this bill. Again, the goal here is to make West Virginia a better place to live, work, and raise a family. And as a parent, I can tell you right now, childcare is absolutely critical. It's absolutely critical for those who want to go back into the workforce. So I cannot be more pleased that we have the experts that we have with us today. And so I'm going to go ahead and stop here and just hand it over to Sarah. What I will say is if you have questions, again, feel free to type them into the chat, type them into the Q&A box. And then at the end, when they finish their presentation, we can go ahead and kick over to questions and go from there. So Sarah, again, thank you for you and your team joining us. And I'm going to go ahead and you can turn off my camera.
Thank you so much, Brian, for having us. And folks, welcome to our webinar this afternoon. We greatly appreciate the partnership that we've been able to create with the West Virginia Chamber, because we know for a fact firsthand that childcare is vital for workforce development, and it's vital for economic development across our great state of West Virginia. Today, I'm joined by two of my incredible colleagues. You'll see on your screen Carly Floor. She's the Executive Director of Youth Development for the YMCA of Kanawha Valley here in Charleston. And then Jeff Olson, who is the CEO of the YMCA in Parkersburg. So they're going to be joining us today and helping me present to you all. And let me share my screen here real quick and we will get started. So Carly, if you can give me a thumbs up and let me know that you can see my screen, we'll be good to go. Okay. So when we heard about Senate Bill 656, it really put us in a unique spot. We are one of the leading providers of childcare in the state of West Virginia and across the country as well as an organization of YMCAs. So the three focus areas of our Ys are very unique. We have three pillars, which are youth development, healthy living, and social responsibility. We do all of these things and everything that we do, whether it be programming, swimming, aquatics, tennis, anything that you can think of, but most specifically with childcare. The YMCAs in the USA are vast. There's 2,700 locations across the United States. We operate more than 10,000 childcare sites. So not only are we one of the leading providers of childcare in the state of West Virginia, but across the country, we are definitely a driving force. We have over 22 million members nationwide, and then 540,000 volunteers. So we are one of the largest entities in the United States and now nationwide. So I'm going to turn it over to Jeff Olson, who's going to share with you a little bit about our local YMCAs here in West Virginia. Jeff? Jeff, you're muted, sorry.
I just said all those brilliant things and nobody heard. No, good afternoon, everybody. Appreciate being able to participate in the presentation today. So there are 8 different YMCA associations within the state of West Virginia. We've created a map, which is on the next slide. Each association is owned and operated separately, although we do report to the same national institution, which is YMCA of the USA. Our service area goes far beyond that. So if you can give me the next slide, Sarah. Thank you. So our immediate service area are the counties identified in yellow. However, I do want to point out that we do have the capacity, any of our YMCAs have the capacity to go beyond this service area. And so if you're in Wayne County or if you're in Preston County, we do have the ability to provide consultation services or training or simply meet with you to go through the various steps that are required that Carly's going to begin to address here in a minute. I do want to point out that as thrilled as we are with the bill and the opportunities for economic development to be improved, we're facing as a YMCA many of the same staff shortages that you're facing. So we not only recognize how important this bill is, we also have the experience and recognize how difficult it is to provide quality childcare in a safe and responsible environment. So our interest is really to help you help the state at the same time. Next slide. Carly.
So I'm going to take it over from here, Jeff, and then we'll have Carly chime in as well. So I think the bigger question that a lot of you are probably asking yourself when you've considered opening a childcare facility on site for your employees is, where do we even begin? It is very challenging, to be very transparent and honest, to operate a childcare center. It takes a lot that someone who doesn't have the expertise or the background knowledge would not be mindful of. With regards to licensure, every childcare facility in the state of West Virginia is required to be licensed through the West Virginia DHHR. There's a vast multitude of steps that you have to go through in order to apply for the license. There are different sets of licenses that you have to apply for, and there are different restrictions that are in place. For example, if you have a playground site at your location, your mulch has to be 12 inches thick. They will come out with a ruler and they will measure that. There are just random things that you would never think of when operating a childcare facility that go into it. That's where we come in and provide that expert knowledge for you. So first thing is contact your local DHHR office and ask about the steps that are involved and what you need to do in order to secure a license. The next thing that you definitely need to consider, and this would probably be maybe my first call over licensure, is contact your insurance provider. Your liability insurance coverage will go up. Anytime that you have a facility or you have children that are going to be on site a majority of your operating hours, you will see an increase in your liability insurance. And that's for a variety of reasons that I sure don't need to go into detail, but please be mindful of that and be prepared for that, because that is something that you're going to need to budget accordingly for. Then when it comes to ratios, this is where Carly's going to jump in, and I'll turn it over to her because she is definitely our childcare expert. Carly?
So when it comes to ratios, when you decide what type of center you want to open, what ages of children you want to serve, then you'll need to decide how many staff you will need. And with staffing, you have to look at ratios. And with your license, there are very strict ratios that you have to follow. For example, you can take children as young as 6 weeks old with a licensed childcare program. So 6 weeks old up to 2 years old, you have a 1-to-4 child to staff ratio. At 2 years old, it's 1-to-8. 3-year-olds, it's 1-to-10. 4-year-olds is 1-to-12. And then your school age program, so your after school program, summer camps, that's 1-to-16. As you are thinking through ratios, you also have to take into consideration group sizes. So it depends on what ages of children you have. For example, with infants, you can only have 8 infants in one group. You can only have 16 2-year-olds in one group. So all of the ratios and the group sizes, that really helps determine how many staff you would need if you do plan on opening a center.
Thank you, Carly. Next is policies and procedures. And so I'm sure with running an organization or any business, you always have policies and procedures in place. With childcare, it's a little bit different. There are strict policies that we have to follow as a childcare provider that are required through our license, that are also required through our insurance providers. But with procedures in particular, when you're dealing with children, child protection is a huge priority for any childcare provider. Specifically with YMCAs, we take child protection very, very seriously. And so your policies have to be extremely in-depth. They can be as in-depth as how you change a child, how you would diaper a child. Those policies have to be in your policies and procedures manual that you have to supply to the state licensing board every year, and also to your insurance provider. But those are something that you really need to have an expert on hand to create for you and for your center. And the main reason that you have those is to not only protect you as a provider and your employees, but also the children that you come into contact with. There are different policies around transportating children. So you can't transport children in a 15-passenger van. They have to be a specialized bus that is equipped with a harness system. You can't do any transporting in a personal vehicle or anything like that. So the policies and procedures are something that you're definitely going to need to think strongly about when creating. The next is a startup supply and furnishings. Carly's actually been a part of starting up a childcare facility, and she's got some data that she can share with you now.
Right. So when it comes to startup supplies and furnishings, there's actually a lot that goes into that. You have to determine again what ages of children you're going to be serving, because your supplies and furnishings are based on the ages of your children. So you'll have everything from shelving to age-appropriate sleeping equipment. You have to have a certain amount of learning centers and a certain amount of equipment that goes into each of these centers. And there's strict list of materials that you need to go into each classroom. In 2015, I had the opportunity to expand our programs here. And that was quite a few years ago. And at that time, I opened a new nursery, and that cost around $10,000 to open up a nursery. And it cost around $7,000 to open up a 2- and 3-year-old classroom. You have to have certain types of plumbing, classrooms where you're providing diapering for children, you have to have a hand washing sink in those classrooms. So those are all things that you have to take into consideration as you're opening up a center.
Thank you, Carly. And to add to that, that does not include any staff costs. That is strictly just for supplies to open a site. And those figures are from 2015. So I'm sure that we can all agree that they're going to be a lot higher than that now with the way that inflation is. Carly, can you talk a little bit about staffing for us?
Yes, absolutely. With staffing, I know I keep mentioning the importance of deciding what ages of children you're going to serve, because this affects your staffing as well. So if you decide that you are going to serve children under the age of 2, that opens you up to a whole separate set of regulations. You have your higher staffing ratios. and your staffing also are required to have more training. They're required to have 40 hours of additional training in infant toddler specific courses in order to work with that age range. Each center has to have a director. That's one of the first starting points, and that is also based on what type of center that you will have. So in the state of West Virginia, centers are listed as type 1, 2, or 3, and that is based on how many children you're serving and the ages. So with a type 3 center, that's if you're going to be serving over 60 children, your director will be required to have an associate's degree specifically in early childhood education or a bachelor's degree in another field. You also have to have another designated person in charge, so an assistant director or a lead teacher who can step in when the director isn't available. And then you have to have a person to lead each classroom, and they have to have specific certifications as well. There's also an ongoing training. Staff in a licensed childcare program are required to have 18 hours of continuing education every year annually. So there's quite a bit that goes into the staffing for a childcare center as well.
Thank you, Carly. Can you talk a little bit about age restrictions?
Yes, so with age restrictions, we talked about ratios and group sizes. You also have to tie in the age restrictions. You cannot combine certain age groups. So that kind of helps you determine your spacing and how the layout of your child care center. So for example, children under the age of 2 cannot be combined with any other age groups. And then your 2-year-olds are separate. And then your 3- and 4-year-olds have to be separate. And then they cannot be combined with anyone older than the age of 4. So there's a lot that goes into deciding your spacing. So your ratios, your group sizes, and then your age restrictions all kind of determine how much space you need and what ages of children you can serve.
Thank you. So another part of the bill that we noticed was that with any of these facilities, that as an employer, you have the option of giving your employees first right of refusal to receiving child care services at your location, and then you can decide whether to open it up to the public. If you are to open it up to the public, there's a lot more that goes into play as well. If you decide to open it up to the public, you are more than likely going to want to decide if you are only going to accept private pay clients, or if you're going to accept those that also receive Connect funding. Right now in the state of West Virginia, as in this COVID environment, if you're not familiar with it, West Virginia put into practice child care provider certificates. So any frontline worker or anyone who is considered a frontline worker right now in the state of West Virginia receives free child care, regardless of their income. Anybody who falls under a certain income barrier would then have to go on what's called Connect, which is the subsidy program. Connect is also the ones that provide the frontline worker certificates currently. There is a huge disconnect, and it's for a conversation another day. And Brian knows we've talked about this pretty extensively when it comes to the reimbursement fees and the income caps for those that receive Connect. For example, we have a single mother of one child who makes $35,000 a year that was just denied Connect funding. So she is responsible for 100% of her child care costs. And then we have pharmacists who right now are frontline workers who don't pay a dime for childcare. So the system is a little screwy right now, but we're hopefully working through it and making some changes. But as a provider of childcare, this is a decision that you need to make. And I think that you need to make it pretty quickly is, are you going to open up to the public? Are you strictly going to only allow your employees to have access to childcare? And are you going to only do private pay? Or are you going to accept subsidy programs? With private pay rates is something that you also need to really strongly consider. You're going to have a different rate for children that are infants, toddlers, and those that are 3 and 4 years old because of ratios and to help you cover some of the costs. To talk about costs, let's talk a little bit about budget. If you are looking to make money in childcare, you need to think of something else to do. You will never make money in childcare. We take it as an opportunity for us to be able to provide back to our community and to be able to also provide and help with workforce development and economic development. but a budget is something that you're definitely going to need to look at. For example, for our facility at Cross Lanes that Carly is one of the sites that Carly oversees, for 116 children, our annual operating expenses are over $700,000. That's your staff cost, that's your supplies cost, and that's some food cost as well that we have to take on for the families that we care for. So that does not include your revenue. In this non-COVID environment, when the reimbursements were not as high for those that are considered frontline workers, we would have operated at a loss. Right now we are okay, but that's something that you definitely need to keep in mind when you are deciding to take on a childcare facility. It's definitely not something that's going to be generating a lot of revenue for you, and you may essentially take a hit. But those are just some things that we have shared that we think is a good opportunity if you're thinking about this from the bigger picture, if you're looking to start something from scratch. These are just a few things that you really need to keep in mind. All of these things we can come in and help you provide for, help you figure out what your policies and procedures need to be, help you determine your license that you need, and so on and so forth. So at this time, we'd like to open it up for questions. I'm sure that there are ones that are probably more in depth, and we are here to answer those for you. As I said, Carly is our childcare expert. She has over 18 years of experience providing childcare in the state of West Virginia. Jeff and I can help answer it from the business side of things. But Brian, I will turn it back over to you if there's any questions.
Well, thank you, Sarah. We've got a few questions in so far. One point I just wanted to make, I think you may have actually covered it, but I just wanted to reiterate on the point about private pay, versus Connect, and that's if you want to expand it and open it up to the community. If you start a facility, we have gotten a few questions, not yet today, but in the past. If you start one of these facilities under this bill utilizing the tax credit, can you charge your employees? And so the answer is yes, you can. However, the credit basically goes for everything but land acquisition. So the credit is available for the building, furniture, construction, renovation, and it's also, there's another credit that's portioned for operating costs, at least for your first year. So if you were to charge your employees, which you can do as an employer, you can make that decision, that would offset the credit that you would be available to get on the operation side of it. So that's just something I wanted to put out there because it's been a question that has been asked. So the first question we got in, let me take it if you don't mind. It was, how do you sell a tax credit if you are a nonprofit? So just to back up, there are actually three different types of credits within the bill. You have your for-profit corporations, and for a for-profit corporation, you would simply take the tax credit on your corporate net income tax liability. If you are a pass-through entity, a small business, say an LLC, then you would take that tax credit on your personal income tax. For us, the really important piece to keep in this bill, and we successfully did, was for nonprofits. We initially had one version of the bill that got all the way through the Senate into the House of Delegates, and then there was concern over the constitutionality. So what we came back to that would make it work was very similar to what is done for historic preservation. If a nonprofit, let's say a hospital, because most of your hospitals are big employers, but they are nonprofits. If a hospital were to set up a child care facility, what they would then do would be apply to the tax department. Let's say their child care facility cost them $1 million. They would apply for basically for a credit to the tax department, and they would get 50% of that, $500,000 over 5 years. Now they can't take that credit on anything. So they would now, the best thing you'd want to do would be to get a tax attorney and then try to sell that credit to a for-profit. So you would probably be looking to sell that credit for maybe 80 or 90 cents on the dollar if you get a good deal. And you'd sell that credit to a for-profit. So you would get paid by them. That's how you get your payment. And then that for-profit would essentially take that credit against their tax liability. It was how we could make sure that we were able to keep nonprofits in the bill, because that was incredibly important to us, especially when you're talking about hospitals that are very large employers, frequently of people, who need childcare. So we wanted to keep that in there, and that was the way to make sure that bill stayed constitutional. There was a question. Let me kick the first one over to you, Sarah. Is regarding ratios. Do the different age groups need to be separated and a teacher for each class if we only have a few children?
Yes, and I will let Carly explain that in a little bit more in depth, but yes.
Yes, the age restrictions are part of regulation. It's for safety reasons. You do have to keep them separated. There's one exception to that rule, and that is at opening and closing, the very end and ending and beginning of the day, you may be able to combine groups. But you also have to, when it comes to your ratios, you have to go by the youngest child in your group. So even if it's the very beginning of your day and you have your groups combined for the first 30 minutes, if you have a 1-year-old, then you can only have a 1-to-4 ratio. You have to go by that lowest ratio at that time. But for the remainder of the day, you do have to follow those age groupings.
Thank you. The next question we have is, are all of the rules and regulations around the bill finalized yet? The quick answer is we have not yet seen them. We are watching very closely for the tax department to come out with those rules. We know what the bill says, but I can just tell you, any rulemaking process, you want to make sure that the rules match what's in the code. So we're going to be watching those very closely. We had actually talked, Sarah and I, and Carly was with us, about when those rules come out, maybe then coming back in with a second webinar to really dive even a little bit deeper into this. But we wanted to get this conversation started because we know there are a lot of members of the chamber that are talking about doing this right now. The next question we had was, to receive the tax credit, does the facility have to be on site or can it be detached from your main operations center? So the bill speaks to the premises of the employer. However, it does leave some room. And again, that's going to be one of those things we want to look at in the rules. But for example, if you are a chemical company, we made sure the bill was written in a way so that you could apply to the tax commissioner to say, you know what, I probably shouldn't have a child care facility here, but we could get it down the street. The other thing that this bill allows that would speak to this question is it allows multiple employers to team together. So imagine everybody inside of an office building or all of the businesses on Main Street. So if you have a number of businesses that team together to create one of these facilities, because individually they wouldn't have the capacity, but as a group they may, ultimately then you would be choosing maybe a location that's best fit to there. So it's something we're watching closely, but the bill does allow some leeway of not necessarily being on the premises in some circumstances. Okay, so here's the next question. Sarah, this is a great one that you could probably jump right into. Is it possible for a company to partner with a third-party provider whereby the employer would provide the facility, but the overall program and staffing would be managed by another party that specializes in childcare? Quick answer, yes. Sarah, do you want to dive into that a little bit more?
Yes, quick answer is yes, absolutely. We hope that you would consider us as that partner, because we are the experts probably in the state of West Virginia, but absolutely. What we've done with childcare is kind of unique in the sense that we have the capacity to go in and be able to operate and manage your childcare site. We would not be willing to take on any of the overhead costs of the startup, because you all would be able to receive that tax credit. But as far as providing staff, providing the director, recruiting staff, things of that nature, and providing the overall operations, yes, absolutely. You can outsource and go the third party route. And I would strongly encourage you to come our way.
Thank you.
Mm-hmm.
Next question you have is back to, would the entity buying the credits have to be approved by the state? What type of reporting would the nonprofit have to provide to the state to show the sale of the credit? So great question. I think all of that will be hashed out in the rules that will come out from the tax department. The bill itself does not speak to that, but what I would imagine is it will look very similar to what has been structured for historic preservation credits, because frequently those credits are taken advantage of by a nonprofit who can't take it themselves, so they have to sell them. So I would imagine look to those, and that'll probably be very similar to the type of rule that the tax department develops for this bill. This is another one, Sarah, you could probably, or someone on your team, dive into. Is there a document that details all of the age restrictions, staffing, rules and regulations, et cetera, that you point us to? Or would that just be someone reaching out to the local DHHR office?
Carly, I'll let you take that one.
Yes, so there is a childcare licensing regulation manual. It's rather lengthy, and it can be found on West Virginia DHHR under the Early Care and Education section of the DHHR website. And that you could download that, the PDF version of that manual.
Thank you.
Yeah, if I could also go back to the last question that I answered with the questions about the small grouping. So the definition of a licensed childcare program is any program offering care for 13 or more children. So if it would be less than 13 children on a regular basis, then that would fall under a different set of guidelines.
Thank you. I'm just looking right now, just giving everybody, if you have a couple questions, as a reminder, type them into the Q&A box, raise your hand, or go ahead and type it into the chat box. We actually have another one that, just reading it real quick here, sorry. Okay, this was actually someone just commented into the link into the chat box. To all attendees, Advantage Valley has put together a similar type of guide, and I believe the link has been provided there as well. And it looks like WVU is also preparing something similar, just a couple of the comments that have come in. Looking here. Next, another question one of you may want to answer is the license and credit available if we would have under 13 children? As far as the credit being available, I think the answer would be yes. The bill does not limit. All the bill speaks to is that it must be primarily for the benefit of employees. It does not put a percentage on there. As far as the license, Carly, Sarah, would one of you want to speak to that as far as if you had a small facility of 13 or less?
Yeah, Carly, I'll let you dive into that one.
I will be honest, I am only familiar with licensed programs. I'm not familiar with unlicensed. I just know that if you have 13 or more children for more than 30 days in a year, you do have to be licensed through the state of West Virginia. So I'm not familiar with an unlicensed program.
I would speak to the business side of that. As a business owner, you would want to be licensed for insurance purposes. As I mentioned, anytime that you have children on site, your insurance liability is going to go up. If it's licensed, that will protect you. So it would definitely be in your best interest, regardless of the number of children that you have. If you have under 13, you're still going to want to go ahead and go through West Virginia DHHR and get that license just to protect yourself.
Right. There are different types of care, such as like family child care centers, in-home care, things of that sort, that has smaller groups. But as for an actual center, which is a non-residential type location, that is when you qualify into a licensed care for 13 or more children.
Thank you. I don't see any open questions right now. One thing I just want to let all attendees know is we have recorded this, so we will be posting this to our website in the nearby future, and also sending out another message with the link to this so that you can go back and listen to this discussion again. If you pay attention to the slide that is up right now, it has Sarah, Jeff, and Carly's contact information. So, make sure write that down, because they're going to be a great resource. It's going to be an absolutely great resource for you. We just did have another question pop in right now. It is, how difficult is it to find someone with qualifications and experience for the higher level roles within childcare? And I can just tell you right now, one of the challenges we're facing through just basically the entire workforce is employers trying to find workers at this point. I think that's across the spectrum. It's one of the reasons we created this bill. But do you want to talk about that a little bit more specifically, what you're trying to find in childcare?
Sure, I'll speak to it from one side, and I'll let Carly speak to it from her experience as well. And Jeff, if you have anything that you want to add. With any staffing right now, there is that challenge. We all face it. You all are facing it, and we're facing it equally. But I will say, from the childcare perspective, when you are trying to recruit somebody with the experience, with the knowledge, you are going to have to pay them more than you would pay a teacher. And it's going to be very challenging to find those folks, because a majority of folks with those qualifications are either already currently employed, or they are probably in the schools. But it's something that we've looked at as an organization over the last year at RY is increasing our wages for our staff. There's a lot of training that goes into it. And as I mentioned before, childcare is never an area where you're going to generate a lot of revenue to be able to cover those costs. So as an employer, you need to look at it from a different view of hiring the best person for the job that's going to protect you and your organization, as well as the children and families that you serve. Carly or Jeff, if you guys have anything to add on that from recruiting and getting those staff, please feel free.
I would just add that to go back to Carly's statement, once you decide what age you want to provide care for, that is a pretty big difference, because when you're dealing with 6-week-olds and 1-year-olds, it's very different than dealing with 2s and 3s. That is a way that, as Carly said, that's something that you have to look at and make that decision, but that will certainly impact your rate of pay and the number of people that are qualified to hold some of those senior leadership roles. And I just want to go back. I think Leslie shared this. It was my understanding when I read through the bill that the tax credits would be available if it was licensed. So if you have less than 13, as Carly said, and Brian, you can correct me, I'm okay with that. But if you had less than 13 and you wanted to be unlicensed, you certainly have that ability, but I don't believe that would qualify you under the parameters of the bill.
That would be my guess. I think you're probably accurate with that. Well, at this time, I don't see any open questions right now. What I'll just let you know, if you do have a question that pops into your mind later on, feel free to email me or any of the three of them that are on this call right now. Our email addresses are pretty easy to get. Mine is bdayton, BDAYTON at wvchamber.com. Again, I want to thank Sarah, Jeff, and Carly for joining us and talking about this. I also just want to give another shout out to Senator Takubo. I know he had to jump off the call to go back and care for some patients. Again, he was very instrumental. One person who has been here as an attendee, I hope he doesn't mind me mentioning him. He hasn't raised his hand or anything. Roger Hanshaw, the Speaker of the House. This is something that he and I actually started talking about this time last year. He was incredibly supportive of this bill. The speaker has said to me the exact words. He thinks the childcare should be viewed the same as infrastructure. We could not agree more. He's been tuned in, one of the attendees. I just wanted to give him a special shout out as well, because absolutely instrumental in the success of this bill in getting it passed. And he deserves a lot of thanks for it as well. That wraps up this presentation, this webinar. Again, I want to thank everybody who presented and everybody who tuned in to listen to it. Give us a couple days and we will get this webinar recorded and posted to our website so that you can go back and listen to it and get ideas. But again, make sure you copy down Sarah, Carly, and Jeff's contact information because they're a fantastic resource. We've already heard from a lot of companies that are looking to start one of these facilities, but they're going to have the expertise, and so that was one of the reasons we wanted to talk to them, because it is a complex issue, but we do think very beneficial to the workforce overall, just to the state, to get more childcare facilities open, get more people moving back here to West Virginia and more people back into the workforce. So with that, I really appreciate everybody for tuning in, and have a wonderful rest of your afternoon. So thank you so much.